Hi, today we will be doing a role play card of a patient who is reluctant to undergo a surgery. So we will be showing how to do this role play card, and I will be explaining to you what has to be looked into the role play card while you are preparing for it. And then I'll be telling about the corrections as well. So let's move on to our speaking session. This is a recording for the occupational English test, and the test is held at Envertis Academy, Kochi on 3rd May 2025. The candidate's name is Andrin Tom, and the candidate number is 2820. The interlocutor is Mary Binoy, and the interlocutor number is 24281. This is role play number 1 for the profession of nursing. Good morning, Andrin.
Good morning.
May I have your identification, please?
Yes, here's my passport.
Yeah, thank you. Okay, here, thank you. Okay, this is a test of your English language and not an assessment of your professional knowledge. So, keeping that in mind, speak as you would naturally. Let us move on to the warm-up session to get you started. This is not in any way assessed. Okay, Andrin, tell me, what made you to become a nurse?
I believe nursing is a calling, and I've always wanted to serve people.
Okay.
And I've come across many nurses, especially the time I spent with my aunt, who again is a nurse, has shown me how they care for their patients, and I also have wanted to do the same, which is why I turned to this profession.
Okay. How long have you been a nurse?
I started working soon after my studies. So this June, I'll be completing my 4th year.
Okay, great. What do you think as your best quality being a nurse?
While there are a lot of skills that a nurse should always uphold, I believe a patient-centered care is what I am good at. I ensure that I prioritize their needs and understand and also deliver what they require.
Okay. Okay. That's the end of the warm-up session. And let us move on to the role play. I will be taking the role of the interlocutor, and you will play the role of a nurse. Well, this is your role play card, and this is your pencil for preparing. Well, let me just get you started. And here starts the 3-minute preparation time. Okay, as I've just given her the role play card. From the role play card, it is evident that the setting is the pre-operative area. This is a known case, and the background details indicate that she's talking to a patient who has to be prepared for a surgery, but is reluctant to undergo the surgery. So this means that the nurse has a task of convincing the patient. So before we go on to convince, she has to find out whether the patient has any valid reason why she's refusing the surgery. For this, as you look into the role play card, you'll see the clues or guidelines on how to go about it. The first task asks you to convince the patient about the surgery, and that the surgery is actually a solution to her present problem, namely her bleeding. Then she has to inquire whether any surgeries have been done and her reason for refusal. The third task is to describe the surgery. So she has to tell what the surgery is all about. The next task requires a nurse to explain the fact that the anesthesia to be administered is decided upon by the anesthetist. After this, the task involves assuring the patient about the surgery being uneventful and asking her not to worry. Finally, the nurse will ask her to sign the consent form. The nurse has to maintain an empathetic tone throughout, and this will help establish the trust, which will later help in convincing about the surgery. Also, the nurse needs to ask her in between whether the patient understands all that is being explained to her. So let's look and hear how the nurse handles this case, going on to the role play.
How should I address you during the role play?
You may address me as Anna. Yes, that's the end of your preparation time. I will now be starting with the role play. If I stop you in between, don't worry. It just means that your speaking time is over. So, shall I start?
Yes.
Okay, please. Yes.
Okay. Good morning, Mrs. Anna. I'm Andrin, and I'll be preparing you for the surgery. How are you feeling today?
Oh, nurse, I'm not feeling too good about this whole procedure. Well, is there any other alternative?
Please don't get so worked up. This is completely a safe procedure, and in order to remove the fibroids from the uterus, this is very much essential because that will help you reduce the prolonged menstrual bleeding and the associated problems. I hope you understand what I'm trying to say.
Yeah, all of you keep telling that surgeries, they're all the same. And, and they create an unnecessary fear. I'm really worried about it.
Okay, Zan, I see that you're very much scared about something. So would you mind if I ask you a few questions?
No, please go ahead.
Okay, so have you undergone any surgeries before?
Oh, yes, I had undergone one for getting my kidney stones removed around 5 years back. And yes, that was the one. Yeah.
Oh, okay. And how did that go?
Oh, well, that was a really bad one because the memory of the anesthesia and the pain that it just lingered for quite some time. And I think that's the reason for my fear.
Yes, I agree to that. I now understand why you've been refusing surgeries.
Okay.
So is there anything that I can do to help you? Since I appreciate that you share this with me. So is there anything that I can do to help you with?
Oh, yes. I really hope I can get over this kind of feeling in me. I just hope something can be done.
Okay. So if I may suggest, how about I give you a detailed explanation of what is going to be done tomorrow as part of the surgery? Will that help you?
I think maybe, yeah, that would help. Yes.
Okay. So yes. So let me explain to you what the surgery is.
Okay.
This is completely a minimally invasive procedure.
Okay.
Where a thin flexible tube with a camera will be inserted through the vagina and cervix into the uterus. Okay. And it will help us to see the fibroids and remove them with the help of specialized instruments.
Okay.
There will not be any cuts. Okay. And also all this procedure is done with like under anesthesia. Okay. So normally patients go back home the very same day, and also they recover in a few days to a couple of weeks. So since, as I stated, there's no incision involved, and also there's no pain, you should be totally fine with it. I hope this helped.
Yeah, it helped. I do understand what you're trying to tell me, but the anesthesia, I'm really worried about the anesthesia. So can you change the anesthesia to some other form? Because last time it was on my spine, so I found that really hurting. Okay. So could you maybe possibly change the type of anesthesia?
Ms. Anna, I completely understand that you're afraid, but we are not authorized to be doing so. I will have to talk with the anesthetist, and I'll put in a word with him.
Okay.
Would that be all right?
Oh, I think so. I think that would help. Yeah, probably. So And as you said, I'll be able to go back the next day. Is that so?
Yes, as I stated, there are no incisions and also it's pain-free. So we should be expecting a quick discharge.
Okay, yeah, I quite understand. Okay. I think this sounds quite assuring to me. Yeah, so thank you for explaining this in so much of a detailed way.
So I'm extremely happy that you're okay with the procedure. So
Okay.
would you mind giving your consent for the surgery?
No, I wouldn't. I would definitely love to give my consent. I think I'm okay with it now. Yeah.
So please sign.
So I hope you'll be there throughout the procedure.
Yes,
Yeah.
completely.
Yeah, that was really helpful.
Okay. So would you please sign these papers?
Oh, yes, I would. I just hope the whole thing goes well. I'm just happy that I got to meet you and you explained everything. I hope things turn out well.
Yes, Miss Anna, I'll be there throughout the procedure with you. Please do not be worried. And let me start with the pre-operative procedures.
Yes, thank you so much. Yes, that was the end of your speaking.
Yes.
Thank you. Yeah, so as we just heard from her, she's done a commendable job explaining the entire card in a very easy manner. But I would like to point out certain mistakes that she made. You see, she kept saying the word okay several times. So it would be better if you could, maybe say all right, maybe one or two times. Don't keep repeating words. Not quite good. Also, when a word is difficult to pronounce, you saw her fumble at the word anesthetist. Now, she could have done two things. Either change the word to something that could be said easily, or probably she could have, practiced the word several times during her 3-minute preparation time. So probably she could have used, like I said, a doctor who specializes in anesthesia. So that could have been said. Another mistake that I noticed is that while talking about the procedure, she goes on about the procedure. She could have actually stopped in between and, asked me if I didn't understand what she's telling me. So that would have been better. It would be, following one of the criterion. Well, I would like you to comment on what criterion she would be following if she stopped there and asked me. Another task for you. Okay. But anyway, if she had stopped and, then gone on with the next portion, it would have been much better. But she's done quite a good job. And this is how a role play card should be done. So you first look at all the tasks and then do it effectively. If you have difficulties during the 3-minute preparation time, deal with it. Okay. So I hope this was quite helpful for you. See you with another role play card. This is Dr. Mary Binoy signing off for now. Thank you.